to the One Piece Implant Mentor podcast. I am your host and mentor, Dr. Andrea Joy Smith. For the past 16 years, I have placed well over 7,000 One Piece implants for denture stabilization and much, much more. The One Piece Implant Mentor podcast introduces our audience to doctors who are successfully placing One Piece dental implants. My guest today is Dr. Larry Stroud. I would classify Dr. Stroud as an early adopter of the one-piece or mini dental implant paradigm. He was in private practice for well over 20 years, establishing Louisville Mini Dental Implant Center in Louisville, Kentucky. Dr. Stroud, welcome to the podcast.
Hello, Andrea. It's good to see you. Good to be here.
It's good to be here too, Larry. Can you tell us a little bit about your dental practice journey, how you started before you started offering mini dental implants?
I was just a general dentist and bought a practice in Louisville, Kentucky, a little office. For years, I was just doing general dentistry in my small office, 3 operatories, 2 staff, had 1 hygienist. I was making an okay, average or less general dentist type of living. And to be honest with you, was not real happy, not real satisfied with it. That's the way I was for 20 years.
So you were in practice about 20 years before you actually started offering the one-piece implant solution?
Yeah, I always felt like I was looking for something different, a niche, something that would turn me on and get me more excited about dentistry. Because, for the money we make, general dentistry is very hard work. So I was always kind of looking for something. I remember at one point I had gotten a little excited about endo and took courses on doing 1 visit endo, and I thought, oh, this is really going to be something, and I'm going to be big stuff now doing a molar endo in 1 visit and build up and crown, and I thought that was a big deal. But after going through a procedure of that and taking a couple hours, I'm exhausted, so that didn't work out real well.
Yes.
In the early 2000s, I started seeing information about these mini implants from MTech, and they were offering these little beginner courses on mini implants where you could put implants without any surgery. I thought that was interesting. I had never done implants. I'm not a surgeon. I had never done surgical implants, but I thought that looked pretty interesting. So I went to the beginner course. They showed us how they work, drill some holes in some pig jaw or something that they had there and put them in. And so it was interesting, but it really didn't give me the confidence to start doing them. So I called the company and they tell me about a representative that does some teaching. So I called him, flew up to his office. He takes me into an operatory pretty much immediately after we meet, and I'm watching him work on this patient. And he just happens to be doing his first technique, putting in a bridge. It's like 28 to 30, putting in a bridge on this lady. He numbs her gum a little bit, puts 3 implants in, no bleeding, no cutting, puts a bridge on there. It's about 30 minutes. We go out in the hallway after we're finished, and I say, wow, that was pretty neat. What did you make on that? He said, well, that was about an $8,000 case. So I go,
wow,
30 minutes, 8,000. Yeah, I think I'm interested in this. So that was kind of my start.
That's great. I was just going to ask you what attracted you to the procedure, and basically the simplicity and the ROI. If you think about that endo that you did for a couple of hours or maybe 1,000 at the most, now I see what attracted you. That's an excellent story. So seeing that very quick procedure, that was a huge factor in your decision, I would imagine, because you were already looking for something like you said before.
Oh, it definitely was. Seeing that you could do something like that, a non-surgical, fairly simple, straightforward procedure, give a patient something that they really want, and make better money than anything we've ever done in dentistry. Most of the stuff in dentistry, we're trying to tell people stuff they need or talk them into doing these crowns and things that they may not necessarily want. This is totally different with these mini implants. If we market ourselves right, the patients come to us wanting this stuff done. They want to be rid of their dentures or their partials. They want their teeth to stay in. They want to be able to eat and chew. What a difference. They come to us wanting this stuff, and we can give them something that they want and make really good money at the same time.
That's the beautiful thing. They come into us well-informed because the marketing and advertising has been very successful. And like I always say, I've never had anybody hug me after doing a root canal on tooth number 15. But these patients are some of the most grateful patients that we'll see. Can you tell me a little bit about the impact to the quality of your patient's life that offering this procedure has had?
Well, it's just like you say, and I've often said the same thing. No one wants to give you a hug after doing a root canal. But all these things that we do, we're literally changing people's lives. People come in that, for instance, hate their denture, won't wear it, won't go out in public. I can remember a lady that turned down going on a cruise with her daughter because she was so embarrassed about her denture that she wouldn't wear, and just all kinds of stories like that
Wow.
that we've all heard. And then you give them teeth and teeth that can stay in and that they can be comfortable with. And it's life changing. It's totally different than anything that we've ever seen in general dentistry, where people can really truly appreciate and are happy for what we do for them. Most time people go to the dentist and they hate to go and they're glad to get it over with. But what we get to see with this stuff is people that really are happy and appreciative, and it's improved their lives, improved their social life. It's amazing stuff.
I completely concur. When you were speaking about your patient who didn't want to go on a cruise, I had a patient once where I had done my version of a full mouth reconstruction by doing a couple crowns on the top, making a nice valplast partial for the bottom. But the only option I had was a lower complete denture with no implant support. I looked into for her getting conventional implants with a metal bar, but that was cost prohibitive for her at the time. And so whereas she used to go out to these daytime parties with her friends, she literally stopped going out. And so I then went on a mission to help solve this problem, mainly for her, but hundreds, if not thousands of my patients have benefited from just that one effort that I put in for this other patient. So those stories are definitely very plentiful. One of the things I really love hearing you talk about is how you pretty much put together a blueprint for a 10-year retirement. Because as you know, practicing the way that we both did for the first part of our career, yeah, you can retire okay, but you're probably going to work a whole lot longer than you want to. So I specifically want you to go into how you put together this blueprint to basically retire in 10 years and tell us all about that.
Well, here's how it started. And I didn't have the blueprint in my mind when it started, but it developed. After that day when I had visited Dr. Shakin and saw him in the office, I came back a changed man and decided that I was going to totally change everything. And that's the thing that I see with a lot of these doctors is if you want change, you have to take action. Fortunately, I was motivated enough that I took action. When I came back to my office, I started doing a few implants with print advertising, some newspaper ads and stuff like that, and saw that I like the way this is going. I think this is going to work. This is going to be a good thing. I was getting some patients in. So I decided to just go for it big time. I went back to my practice and we had a little meeting and decided, okay, we're going to change. We're going to become a mini dental implant practice. I became one of the early implant centers and decided we're going to stop doing dental dentistry and all we're going to do is these implant cases. We were marketing heavily, doing the TV advertising that a lot of us do. And the patients were coming, and that started the journey, and it just changed everything. We went from a general practice that just does some random fillings and a denture now and then and maybe a root canal to within a few months, my days were now every morning started with a sizable implant case. As a general dentist, you might have days where you may not collect $1,000. Well, now every morning started with a $10 to $15 to $20,000 case that was paid for. Dentistry is a whole lot more fun when you could start every morning like that. We would do a big case in the morning, and then we're doing adjustments, seats, whatever. And then we would have 3, 4, 5 new patient consults every day. And all of these consults come in excited about it. They've seen me on TV. They already know me. They want the procedure. And so it's easy. It's not like having to sell these patients. You just show them how this works. And if you can work out the financing, then they're ready to go. So that started a process of over that 10-year period of starting every day with a big implant case. My income and production quadrupled by a factor of at least 4, maybe 5 times the income. I stayed a small office throughout all this, just myself and 2 staff, and we made it work. So we were a lower overhead situation. After a 10-year period, I think I ended up at 15,000 implants placed. We produced about a little over $2 million a year, which is not real big for some of the big hitters, but for me, with just me and 2 staff, that was pretty good. So if I was grossing $2 million, I was keeping $1 million. So that wasn't bad.
From your lectures, I know that your staff benefited as well. We would all bring our staff to these meetings, and Dr. Stroud gets up there telling us his wonderful story that we're all clamoring to hear. And then all of a sudden you say, oh, and I give my staff $15,000 bonuses too. And my staff would give me the stare like, wow, when are our $15,000 bonuses coming? But it's all a testament to what you've decided to do. You kept yourself that low overhead, low number of staff. And The marketing and advertising has been the secret for many of us because, like you said, the patients come in, they feel like they know you, they're pre-sold. They've been looking for a solution for years. They've already been to larger implant houses and been told that they have to basically get a second mortgage on the house to get one arch done. And it just hasn't been feasible. That's one of the things we both love about this implant. Is a lot more affordable. Let's talk a little bit about that. If you had any experience at all with conventional implant patients coming in for consultations for the small diameter or the one-piece implant.
Oh, yeah. That was a big part of my presentation to every patient that I would see when I would go over the treatment plan. I would always first show them procedures, show them the models, and they're always excited about it and want to do it. But then when I would start discussing the fees, I would always compare it to surgical implants, what they would go through, the surgery, the time, the cost. I would always sort of compare what we do to that. So when you lay out the surgical implants with the amount of surgery and healing time and discomfort, the cost, and then compare it to what we do with no cutting and no surgery and much less to go through and about half or less the cost. In fact, a lot of my patients, after I'd go through that, they'd say, well, why wouldn't everybody do that? And I'd say, well,
I get the same response.
I'm trying to tell people.
We're trying to get the word out. And Dr. Stroud, that is exactly what this podcast is all about, because a lot of the dentists I'll be speaking to, they don't know anyone else who is doing this procedure. I think I heard a statistic like there's only about 10% of all dentists doing any type of implant. And there's even a smaller percentage doing the one piece or the mini dental implants. So people don't really know about it. So our job as clinicians and as people who really want to help patients, these patients have been told that they're not candidates for conventional implantology a lot of time because they don't have enough bone, or they have enough bone, but they don't have enough money. The thing about these one-piece implants is we can treat both of those patients. Wouldn't you agree?
We just got back from the Orlando seminar and had Dr. Gordon Christensen there. And he was just making the point that all these surgeons that are only using the traditional surgical implants that are 3.5 and larger, they're leaving out half the population. That was a big point he was making is, hey guys, come on, get with it. These mini implants, these one-piece implants, they work. And half the population are not candidates for the big guys, but they need these smaller implants. So there's a whole lot of people that could have this done that the surgeons aren't able to help.
That's absolutely correct. Actually, I've often gone to lunch with some of the surgeons that have moved into the area. And when I let them know what I'm going to do, their first question is, well, what are you going to refer me? And then they say something like, well, if you're going to cut the cost of implants, of course the people are going to come to you. And then I said, well, wait a minute. These are not your patients. I am marketing for these patients. They're coming to me because of what I can offer. So we're not really responsible to send patients to oral surgeons. We refer them a few $100,000 a year and they give us a box of cookies and we're supposed to be, really happy about it. Now, I won't say anything bad about conventional implants. They certainly have their place. They've helped a lot of people go from being basically a dental cripple to being dentally healthy. For all intents and purposes, they have their place. But we're here to say that small diameter, one-piece implants, mini dental implants, it goes by a few different names, are also a viable option.
No question, no doubt about it. I don't say anything bad about the surgical implants, but for years and years, they have loved to say bad things about the small diameter implants. But now the research is coming out and they're sort of having to eat their words now, aren't they?
Yes, they really, really are. With that Harvard study that came out a couple of years ago, where I believe it was the dean of the dental school or one of the major dentists in that arena talked about small diameter implants. And I have that article that I'm going to be sharing with our audience as well. So, Dr. Stroud, you, all of my colleagues, I feel like we've become instant best friends because we see this way of practicing that not only helps our patients, but it also helps our practices too and extends our practice life. So thank you so much for sharing your story and your blueprint. I'm pretty sure that there's so many people that your story is going to ring true to. It's going to be very familiar, and they're going to give these one-piece, small diameter, mini implants another chance. And thank you so much for contributing to that.
Well, I'm happy to be a part of it, Andrea, and thanks for all you're doing. And yes, I encourage all you guys out there to look into this. This is the way to go. Probably the best thing in general dentistry that we have, these mini implants. Thank you so much.
One last comment. I think that by far, hour for hour, startup costs, just everything, It is actually the most profitable thing that I do in dentistry, or that can be done in dentistry. Would you agree with that assessment?
There's no question. It is the most productive thing we can be doing in dentistry. Maybe one of the most productive things done in all of the dental medical field.
I believe so too. And if you think about it, surgery in general, whether it's open heart surgery, knee surgery, hip surgery, they're doing a lot of these things arthroscopically. They're not tearing the patient open completely to complete these procedures unless it's absolutely necessary. And dental implants are certainly in that category of things that can be done in a less invasive, less surgical way. So kudos to us for being willing to take that step to do it. And it's just great for our patients that are willing to take that step and do it as well.
Oh, yeah. Now the oral surgeons are going to have to get on board. They see that the wave of the future is less invasive, non-surgical. Yeah, this is definitely the future, just like in every other area, like you say.
Well, Larry, thank you again for joining me. It is my pleasure. We don't get to see each other very often, but I still feel like every time we speak, no time has passed because we share this same love and passion for this particular protocol and procedure. And just the fact that we can provide it to patients who could never even receive dental implants at all. So thank you again for joining the podcast and spreading the word with me.
Oh, you're welcome. Thank you so much, Andrea. Appreciate what you're doing, and I'll see you soon.